So hello everybody, thank you for joining us today. My name is Aline Sigler and I'm a specialist with Provider Outreach and Education at WPS. And assisting me today behind the scenes is Mary Sue Gardner. I want to thank her for being here, being my co-host. You'll see her adding some details and some things in the chat. She's also going to help monitor that chat for me for any questions that you might have. So I want to thank her for helping me today. Today's session is about the new Prior Authorization Request status search function. So we have a new tool that we want to show you today to make sure that you're aware of. We do have a few housekeeping things that we want to run by you before we jump into our presentation. And one of those things is to encourage you to visit the Training Center area of our website. This is where we post event materials for webinars, and we do that about a week in advance. So if you want to download a copy of the slides that we're using today, you can find it on our live events page. And this is also where you find out about and register for upcoming educational events. So you may have gone there to register for this event, or someone may have forwarded a link to you. And so we want to make sure that everybody knows where to find those things. Also, this is where the recording of this and other webinars will be on our website. We have an encore presentations section. Normally, encores are available for 60 to 90 days, depending on the number of events that we have. If you've looked at that list, it is quite long, or has been quite long recently. And so they kind of rotate on and rotate off. You can also find the recordings on our YouTube channel. We do understand that some people can't get to YouTube on their work computer or during work hours. And so just know on our Encore Presentations page, we also have a player embedded where you can watch some of those videos without breaking those regulations for your workplace. If you have questions related to today's topic, you can add them to the chat. And then at the end of our prepared remarks, we'll take as many questions as time allows. Whether you're listening to this live or as an encore, we hope you'll take the opportunity to give us your feedback by taking our survey. Those surveys are so important to us to let us know how we're doing and to give us insight into the kind of education that you want and need. Now, this is our disclaimer. We have this in all of our presentations. This is to inform you that the information that we're providing is as accurate and complete as it can possibly be. Medicare, being a federal program, is very fluid. And as you might know, sometimes it changes often. And so just know that the federal regulations are going to take priority over anything that's in the presentation or that I say. And then finally, CMS does prohibit the recording of all of our educational events for profit-making purposes. There really would be no need to record it or take screenshots because we're doing that for you. And so just to let you know some of those legal things before we get started. This slide contains the acronyms that were used in the creation of this presentation, or that I know I'm going to be mentioning during our time together today. You know, we have a lot of acronyms. That's kind of an understatement in Medicare. And so rather than spell everything out every time, we give it these acronyms. And so this is just a quick way for you to go and look back at those and define them, especially if there's something that you're not quite as familiar with. So we like to give those to you. So what are we going to talk about in our time together today? We're going to start with an overview of the prior authorization program for hospital outpatient department services. And by overview, I mean very brief, high-level overview, because that's not the focus of our time together today. The focus of our time together today is to learn about that status search tool for our prior authorization requests and take a look at that. So starting back in calendar year 2020, the Outpatient Prospective Services System and the Ambulatory Surgical Center final rules established a nationwide prior authorization process and outlined requirements for certain hospital outpatient department services. Now, this is something new in the Medicare world, or was something new in the Medicare world. Other insurances, private insurances, even Medicare Advantage plans have been using a prior authorization process for quite a long time. But that's where CMS said, hey, we're gonna try this for certain services in certain situations for certain beneficiaries, and here's how it's gonna go. That prior authorization program for these certain outpatient services is to ensure that beneficiaries can continue to receive medically necessary care while still protecting the Medicare Trust Fund from any improper payments and unnecessary increases in the volume of covered services. So it's a checks and balances or monitoring process that CMS is starting to utilize. And just to clarify, the prior authorization process does not change any of the existing medical necessity documentation requirements within the Medicare program. That would be a different regulatory change with different requirements coming out. And so this doesn't alter that in any way, any of those existing documentation requirements. So how does it affect billing? Before providing any of the services that are listed in the regulations, and I know we haven't talked about that yet, but we will, and before billing Medicare, hospitals have to submit a prior authorization request. This is only for services on a 1-3X type of bill, so it's not for our critical access hospital partners. This has been asked many times. CMS has answered it. It is in their frequently asked questions. So just to clarify, this does not pertain to outpatient hospital services billed by critical access hospitals on an 8-5X type of bill. So I just wanted to make sure and state that. Now, could that change in the future? Would they be pulled into this prior authorization process? Possibly. But as of today, they are not. So this slide has a list of the current categories. Now, these are categories of services that are subject to the prior authorization requirements at this time. Also included in the prior authorization process, not part of our conversation today, but we do have certain ambulance services that do require a prior authorization review. Also, you won't see them listed here. I will show you where that is on our website, though. For a list of the actual codes, so not just that your service that you're planning to provide falls into one of these categories, but there are certain codes within these categories, and they're listed on the CMS website. If you haven't looked at our slide deck yet, towards the end of the presentation, we have a resources slide. That resources slide contains a link to the list, among other things, of those particular codes. We also have a list on the WPS site. So if you want to take a look at those specific codes, you can certainly do that. We'll look at some of those different things where you can find those resources in just a few minutes. So to help with expediting the review process, medical review, which is a department within WPS, they suggest that you complete the prior authorization request form and place it on top of your documentation when you send it in. Providers are strongly encouraged to use what we call the Secure Net Access portal, which is the secure side of the WPS website. Or you can use the ESMD to submit documentation. A secure fax or postal mail is also acceptable, but we are encouraging providers. It's faster, it's more efficient. You get instant notification when it's uploaded into our system, and so that's why we're encouraging providers to use that whenever possible, but of course, it is your preference. So when we receive a prior authorization request, we have 7 business days to review that and issue a decision. So whether that decision is affirmed or non-affirmed, we have 7 business days to get that to you. And we call that our standard timeline. This recently has changed from 10 days to 7. So if you have earlier documentation or resources that state 10 business days, it's not wrong. That's what it used to be, but it is now 7 business days. We do also accept what's called an expedited request. And you can see listed here that an expedited decision is issued within 2 business days. Now, keep in mind that scheduling does not constitute a reason for an expedited review. They're only acceptable if the standard timeline would seriously jeopardize the beneficiary's life, health, or ability to regain maximum function. If we receive an expedited request and it's validated, we will make that decision within 2 business days. If we get an expedited request and we look at it and it doesn't justify the expedited timeline, the request will be converted to the standard timeline and you can expect a decision within those 7 business days. When a decision is made, a detailed letter is going to be sent to the requester, and it's going to contain what we call a unique tracking number, or UTN. And that number has to be on the hospital's claim if the prior authorization request was affirmed. It is valid for 120 days from the date of the decision. The Part A claims processing system, which is known as FIS, the Fiscal Intermediary Standard System, it will reject your claim if the UTN is not included. Even if we have that affirmation on file, that UTN has to be on your claim in order for it to process. If the decision is non-affirmed, what you can do then is resubmit your prior authorization request, and what you'll want to do is include the prior UTN if you have one, and then also include any additional documentation that you think will help correct the decision from non-affirmed to affirmed. So just know that, once you submit that request, if it comes back non-affirmed, take a look at it and the reason why, and then know that you can send it in again with additional documentation and ask us to unofficially reconsider and make that an affirmed decision. Hospital outpatient departments that demonstrate compliance with Medicare coverage coding and payment rules related to the prior authorization process might be eligible for what we call an exemption from the program. So this is the next thing that we're going to talk about here, the prior authorization exemption. To be eligible, that outpatient department has to submit at least 10 prior authorization requests during the standard review period and achieve a provisional affirmation compliance rate of at least 90% during an annual assessment. This exemption then will remain in effect for a 12-month period or until CMS elects to withdraw the exemption. Whether you have a notice of exemption or a withdrawal of an exemption, we will provide at least 60 days prior notification to the effective date for that. So if either of those change, we will let you know. After the request is submitted, what happens next? How do you monitor where things are in the process? Hospitals and physician office staff can view the status of a request for a specific beneficiary. Until recently, you were actually required to authenticate within the SecureNet Access portal. And even when you did that, you only could see the NPIs that you had access to. So we heard from a lot of providers who didn't necessarily submit the prior authorization request, but are affected by the outcome, and they didn't know where that stood. How could they find that? And so what we've done is we have enhanced the ability for you to check the status of a prior authorization request for a specific beneficiary. With this tool that we now have, we can help you do this. We have a prior authorization status search tool that was just recently developed. It's now available for use. And so that's what we're here to talk about today and reveal to you, to show you how easy it is to use this. It's on the public side of our website, so you don't have to log into the secure portal anymore. It's in our tools section. If you haven't checked out our tools section, we have an abundance of self-service tools, and more are in the process all the time. So just know that we heard you, that we knew that this was something that you needed, and that now we're excited to be able to offer that to you. I said it's in the tools section. You can also find it in our quick links. We're going to take a look at both of those places in just a moment here. And so then what it does for you is it presents you with a form that looks similar to this here, where you fill out that form, you enter the facility or the supplier's NPI and PTAN. I want to pause here because this is important, because if you are a physician or a supplier, since we're talking about the prior authorization for hospital outpatient department services, and only those specific services that we talked about, you need the NPI and the PTAN for that facility or supplier that this is subject to. So just know that there is a difference there. Then you're also going to need the beneficiary's last name, the first initial of their first name, and the last 4 digits of their Medicare beneficiary identifier or their Medicare number. And then the last thing that's required on this form, this very last, and you'll see that it is a drop down, is the prior authorization type. So let's take a look at those prior authorization types. So this is just kind of a zoom in of a screenshot of that drop-down list that you'll be presented with. If CMS adds additional services that are subject to the prior authorization process, they will be added here. So you'll see that there's blepharoplasty, rhinoplasty, and then we didn't speak about it, but also the repetitive scheduled non-emergent ambulance transports are also part of this process in a different way, but you can also use the form for those types of services. So then after you do that, you hit the search button. If you made a mistake, you want to start over, you can also push the clear button that you see there. So once you do that, Then you'll get your search results. Once you complete the form and press the search button, if the request was found, you'll see the results. So at the top here, it's going to display the information that you entered, the NPI, the PTAN, and the beneficiary name. I blanked them out just so that we're not violating any sort of PHI or PII. So I've redacted this example here. So then once you see what you've entered, then you'll see the results. You'll see the UTN. Again, that stands for Unique Tracking Number. And then it'll give you the status. It'll give you affirmed, non-affirmed, partial affirmation, pending, or rejected. And then it also gives you a short status. And I know this screenshot might be a little blurry on your screen. So just down here at the bottom, you'll just see kind of a description of what that status is. If the request is not found, you'll also get a message about that. I don't have an example of it, but it'll just say that it isn't found. And you might get that if you haven't waited long enough before from submitting the request to checking the status. They suggest you wait about 24 hours for it to update. So this is just a sample of how it might look. If you have additional requests, there's a button up at the top that says back to search. So you can enter another request if you want to, but it's pretty self-explanatory. So as promised, here are some resources that are related to the prior authorization process if you want to read more about it. The first one is the CMS operational guide, and this is specifically related to the hospital outpatient department prior authorization. So you can see that here. We're going to jump out there real quick just so you can kind of see what it looks like. It'll take just a second to open up for us. I always cross my fingers when I do this to make sure it goes to the right thing. So here's that operational guide. And what that operational guide does is that it outlines the purpose and the statutory and the regulatory requirements. Excuse me, all of the official guidelines for the program, excuse me. Gotta love cold and flu season. So then if we go back to our PowerPoint, I've also listed, and I mentioned this before, this second is a list of those codes for the services that require prior authorization. So this is on the CMS website, so you can see here. We had a slide that listed those main categories, but here are the actual codes that the prior authorization process is related to. So I wanted to make sure you knew where to find those. Now the next couple resources that we have here are on the WPS site. So I'm going to pick one of those. And I've already been out there today, so I chose my jurisdiction. If it's the first time you've entered the website in a day, you know that it will ask you for that. And so here is where you can read about the prior authorization process. I know that we just did a quick high-level overview of the process, and we specifically talked about those certain hospital outpatient services, but you can also read about the requirements for the repetitive scheduled non-emergent ambulance transports. So I want to make sure you know where to find that. And then you can see there are links to a lot of other tools and resources for you. Also within our website, we have an overview of the prior authorization process. We also have information about the exemption process. So let's go out to our website, excuse me, and take a look at those. And of course, coughing makes my eyes water too. I'm going to go to our homepage just to show you how to navigate here. The links are great, but if you ever have encountered a broken link, it's also good to know where to go to find that. In the Topic Center, go to Medical Review. And then what I'm going to do is I'm going to scroll down. I'm not going to go too fast because I know that can wreak havoc on our eyes. So I'm going to scroll down. And we actually have a section for prior authorization. And if I expand that, you can see all the different things that we have. This prior authorization page is the one that I was just on. And then here is the exemption process that I mentioned. And then also the overview. So all of those things. And then you'll also notice that we have resources dedicated to some of those specific services. And I know that's more than what we plan to get into today. But again, I wanted you to know where to find those. Now, the heart of why we're here today. If I go back to the home page, and you'll notice here on the right side in the quick links, we have a prior authorization search. You can jump to it right from there. But again, I want to show you how to navigate. So by going to Tools, All Tools, it's the newest, and these are in alphabetical order. Excuse me, they're not in alphabetical order anymore. It is the Prior Auth Request Search, the very last tile currently on that page. And so I had the screenshots in the slideshow in the event that our website wouldn't be working properly or the tool wasn't quite ready for use, but it is. It's here and it's ready. So by filling out the form with the supplier or facility NPI and PTAN, remember, you might have to get those from the hospital that you're working with if you are a physician who is affected by the outcome. The last name, the first initial of the first name. Now, if I were whizzing along and typing in this form and I put Jones and I jump to the next line and I put Mary instead of just an M, I would get an error. So if you get an error, if any part of this is not filled out correctly, you'll get an error that's going to highlight for you and let you know that there's something that needs your attention. Or let's say you accidentally key in the whole Medicare ID or the last 5 digits as opposed to the last 4, whatever the case may be. And then that drop down that I discussed with you on the type. This is going to narrow down your search so that the system doesn't have as many requests to search through to find the one that you're asking about. Very easy to use. If I go back to our resources slide, a couple more things that I want to talk about. The tools and self-service page is what we just looked at. The portal user manual, that's going to outline step-by-step with screenshots for you how to actually request the prior authorization. So I'm focusing on how to show you how to find the status of that, but if you want to know how to actually send us the request using our portal, that portal user manual. And then our prior authorization playlist. We've done multiple sessions related to the prior authorization process, whether that's for the ambulance services or it's for those hospital outpatient department services. We have information about reviews that have been done and issues that might have been identified within those reviews. And so that is also an excellent place to go to find more information on not just the status of your prior authorization, but prior authorizations that have already been reviewed and what they're finding. What I want to do now is I want to check in with Mary Sue. I want to see what questions you have specifically related to the prior authorization request status search tool. And so I'm going to check in and see what you've got for me. Mary Sue?
Hi, Eileen. There are no questions that you have to address right now.
All right. Well, thanks for checking for me, and thanks for being here with me behind the scenes. When I'm sharing my screen, I can't see the chat, so your help is very much appreciated. I'm going to continue on here because we have a few things in closing that we want to make sure that you're aware of. In a few minutes, within the next half hour or so, what you're going to receive is an email, and you're going to get an email at the same email that you used to register for this event. And we don't want you to delete it without reading it because it does contain some important information. Number one, it gives you another way to take the survey. We've already mentioned the survey. We have a lot of different ways that you can do that. So that's one thing that we wanted to point out to you. It also contains the contact hours via a statement that is a certificate of achievement. So if you need those contact hours to submit for continuing education units, you know that that's included in that email also. It has your name, it has the title of the course that you attended on what day, and then the number of hours to turn that into whichever accrediting body that you are seeking those CEUs from. So we wanted to make sure that you are aware of and look for that. If you don't see it, I recommend checking your junk or your spam folder. Sometimes, especially things with attachments, our firewalls think that it's bad or spam, and so it might block it. Make sure that you add the WebEx email address to your safe sender list. If you're listening to this as an encore, we do thank you for your interest in our education. However, we don't have any way to verify your attendance, that you attended the whole or listened to the whole encore, and so it's not possible for us, unfortunately, to send you a certificate of achievement. If you have any questions, you do have a week from today to send those in. Use that same education email address that we've given you in the past. Put today's date and then something about the prior authorization request tool in your subject line. That way the person who's monitoring that mailbox will know to send those directly to me. Please, please, please take a few minutes to complete a survey about this course. Tell us what you liked. Let us know what we could do better. So make suggestions for future education. We look at those surveys on a daily basis, and so does CMS. They all go to a database that we all have live access to. And so we do take those responses very seriously. You do have a few options, as I mentioned, depending on your preference. You can use the link in the chat, or when you exit the webinar, you'll be asked to go to an external site. And that external site is the CMS Qualtrics page for this survey. And that message will look something like this box down here towards the bottom. It's going to have that blue continue button and that triangle at the top. We don't have any access to change the verbiage on here. And so we just want to make sure if you're new to WPS, education, you might not recognize what that actually is for or what it's trying to do. So we're just trying to reassure you that it is safe. And if you click that blue continue button, it's just going to take you to the survey. Now, if you're listening to this recording as an encore presentation, we still would like your feedback. And so you'll see a box that looks like this one here with the hand, the finger, the stars there. And so that'll be a live link to go out to the survey. Or if you scroll down in the description of the video, you'll see a link listed there too. So let us know if you would recommend our education to others. How likely are you to attend future sessions, things like that. again, we look at those every day, and we do take your feedback very seriously. And we just want to give you options, whatever works best for you. We want to know what types of education you find most beneficial. So on behalf of myself, Mary Sue, all of us in Provider Outreach and Education, I want to thank you for your participation. Sorry. We know your time is valuable, so we appreciate you spending a little bit of it with us today. Even if you had to listen to me cough, I apologize. We hope to have you join us for future education, and you may now disconnect. Thank you.